Very good evening to everyone. On behalf of Walters Kluwer, a warm welcome to our speakers and attendees of this webinar under our Medical Edge series. Our topic today is mental health for medical students. Now I request Dr. Goyal to just share his screen.
Thank you, Raviji. Good evening, everyone. And we have a light panel which is Dr. Sandeep Grover, Dr.
Goyal, your screen is
Manish
not visible,
Batla.
sir. Dr. Goyal, your screen is not visible, sir.
By mistake, I closed the file.
No issue, sir. You can hide again.
We have a light panel of Dr. Sandeep Grover, Dr. Manish Batla, Dr. Naresh Nebinani, Dr. Siddhar Sarkar, Dr. Vikas Menon, Dr. Shri Mishra, and moderators, Dr. Majid and myself.
Dr. Goyal, your screen is still not visible, sir. You have to share a
I
file.
have not shared yet.
Acha, okay, fair enough, sir. Sorry, sir.
Just give me 1 minute.
Sure, sir.
By the time file opens, as you know, topic of today's panel discussion is mental health for medical students. And in recent decades, there is a growing attention to psychological distress among medical students. And stress among medical students has been investigated in several studies. At the start of the medical peers, but many studies suggest that students' mental health worsens during the medical training. And common stressors include adjustment to medical school environment, heavy workload, sleep deprivation, poor learning environments, financial concerns. These stressors can lead to many consequences such as anxiety, depression, impaired academic performance, impaired competency, and medical errors. And to discuss these issues, this panel discussion has been planned, and all the panelists have vast experience in promoting the mental health in medical students. I'm not able to share the slides.
No issue, sir. I'll share it from my side. No issues.
Am I audible?
Yes, sir, you are, sir.
Ravi, can you share the slides?
I'm doing it right now, sir.
Dr. Sandeep, you can go ahead. I think slides are visible.
Well, again, thank you so much for attending today. So let me introduce our moderators for today's session. Our first moderator is Dr. Sandeep Kumar Goyal, who's Senior Consultant, SPS Hospital, Ludhiana. He's also former professor and head of the CMC Ludhiana. He has a teaching experience of all 12 years. He has done his advanced course in medical education from MCI. He is the president of Indian Psychiatric Society of the North Zone of India. He has written 17 book chapters and edited a multi-author psychiatry book for undergraduates, medical students, Essentials of Psychiatry. His area of interest is child and adolescent psychiatry and medical education. Our second moderator is Dr. A.B. Majid. He is head of department, SKIMS, SKIMS Medical College, Srinagar. He is honorary general secretary of Indian Psychiatric Society, North Zone, and IAGMH. He is also a member of Direct Council, Indian Psychiatric Society from 2017 to 2020. He is a member of World Psychiatric Association, Additional Psychiatry Section, WPA. He has done some international fellowships like American Psychiatric Association. He has done many national and international papers, including book chapters. He's also a recipient of National Award of Excellence in Mental Health, Glory of Award, India Award, and Rashtriya Gaurav Award. Now I request Dr. Goyal to please introduce our panelists today.
Thank you, Ravi, and sorry for the technical glitch. I was disconnected. And we have allied panel of Dr. Shri Mishra, Dr. Siddhar Sarkar, Dr. Naresh Nebanani, Dr. Vikas Menon, Dr. Manish Batla, and Dr. Sandeep Grover.
To take it forward, thank you, Dr. Sandeep Goyal. I'm the moderator number 2 for the session that's being held today for, although it's for medical students, but since it was on many platforms, and I think many of the other students from other academic courses would have joined it. So it is generally for everyone, and especially for the medical students that have joined in. But since the students have same issues, whether they are in any college or university or any school, so they will share, they will almost, a panel of psychiatrists that we have will share their experiences regarding what different stresses the students go through their lifetime once they are in school or college, and how to cope up with them. And to start with the introduction of the panelists, we have Dr. Shri Mishra, who is an assistant professor of Department of Psychiatry, AIMS Bhubaneswar. She has more than 8 years of experience, more than 20 publications. He is also nodal officer, student mental health, AIMS Bhubaneswar. I think this is a very good concept, the novel concept of having a student mental health in an institution. Areas of interest are youth mental health, women's mental health, addiction psychiatry. You are welcome, Dr. Shri Mishra, to the panel discussion.
Thank you, sir.
Next panelist is Dr. Siddhar Sarkar. He is Associate Professor, Department of Psychiatry at AIMS New Delhi. And he has been working in the field of addiction psychiatry and has presented nationally and internationally. He has won several awards, including the Young Psychiatrist Award of the Indian Psychiatric Society. His interests include genetics of addiction and physiological markers for substance use disorders. He has received funding for a project on exploring barriers and facilitators of addiction treatment and on genetics self-harm among substance use disorders. He has served in the editorial board of several journals in the field of psychiatry. We welcome you, Dr. Siddharth, to this panel discussion.
Yes, sir. Thank you, sir.
After the introduction of a dear friend. We have another dear friend on the panel, that is Dr. Naresh Nebinani, who is an additional professor of Department of Psychiatry, AIMS, Jodhpur. He is editor of Indian Journal of Child and Adolescent Mental Health, associate editor of Journal of Mental Health and Human Behavior, Frontiers in Psychiatry. He is convener of a publication subcommittee of IPS, convener CME Committee of Indian Psychiatric Society North Zone, that is our society, Subdean Students Welfare, AIMS Jodhpur, and his areas of interest are child and adolescent mental health, addiction medicine, consultation, liaison, psychiatry, yoga, and mental health. He has many publications. He has many awards, including A.K. Kala, Bakshe, G.C. Boral, DNB Gold Medal, WP, and Asian Early Psychiatrist Fellowship Awards. Welcome, Dr. Naresh, to this panel.
Thank you, sir, and thank you, dear delegates.
Majid, you can introduce Dr. Vikas Menon also.
Thank you. Dr. Vikas Menon is an additional professor, Department of Psychiatry, JIPMER, Pondicherry. He completed his postgraduate training in psychiatry from JIPMER itself, and subsequently he was awarded DNB Psychiatry in 2009. He has more than 13 years of experience. His research interests include digital psychiatry, suicidology, and mood disorders. He has published more than 230 peer-reviewed research papers, 7 book chapters in edited volumes, and delivered several invited lectures on student mental health. Welcome, Dr. Dr. Vikas Menon.
Thank you, sir.
Then we have Dr. Manish Bartla, another very dear friend who is a professor of psychiatry at MMI MSR Mulana. He has graduated from Varda in 2003. Further, he pursued his post-graduation from prestigious Muller's Medical College, Mangalore in 2006. Teaching experience of almost 15 years. He has national and international publications to his credentials. Areas of interest are de-addiction psychiatry, child psychiatry, and sleep medicine. He is founding member and general secretary of IAPP Haryana branch. Welcome, Dr. Manish Bartla.
Thank you, sir.
Till Sandeep Goel joins us back,
Yeah.
I think I will have.
Yeah, I'm back. I'm back.
You're back, so you
Yeah.
can introduce our another dear friend.
It is my proud privilege to introduce Dr. Sandeep Grover, who is my mentor and dear friend. He is professor at PGI Chandigarh. He has 716 publications in peer-reviewed journals, and he has written 62 book chapters and edited 4 books. His H index is 50, if you are aware of the H index, and his publications has 11,729 citations. He is editor of the Journal of Geriatric Mental Health and Journal of Mental Health and Human Behavior, and he is associated editor of Indian Journal of Psychiatry, Indian Journal of Psychological Medicine, Journal of Psychosexual Health. His areas of interest are CL psychiatry, geriatric psychiatry, severe mental disorders, psychopharmacology. He is the in charge of the crisis helpline in the PGI, and sir has won multiple awards, and among many awards, he is awarded thrice by Indian Council of Medical Research for his research work. We welcome you, sir.
Thank you, Dr. Goel. It's my privilege to be part of this program, and I'm humbled when you say me as your mentor, but we are good friends and we work together. So I look forward to participation in this event.
Thank you, sir.
Thank you, Dr. Goel. Thank you, Dr. Majid, for the introduction of our panelist. Now, before we go on to the session, sir, I would also like to say that we'll be taking all the questions from the attendees at the end of the webinar. And I request all attendees to please post all your questions in the Q&A panel of the event. We'll try to address the maximum question at the end of the session, for sure. Also, sir, we also provide all your feedback. We also provide the feedback link at the chat section, where we request you to please provide your feedback on this complete session. Now, let's begin our session with Dr. Goel and the other panelists. Thank you, sir.
Next slide, please. We have actually 2 rounds of questions for one. Every round carries a question for each panelist. Can you move to the next slide, please? Yeah. So the question for Dr. Shri Mishra. We understand that COVID has been there for last 1.5 year now, and as such, our curriculum is very long and stressful. What are the common mental health issues that you see among students in general and medical students in particular?
Okay, first of all, good evening, everyone. I've been taking care of the student mental health cell of AIMS Bhubaneswar, so I'm much more, I'm aware of the issues about the medical students. But yes, the issues are almost kind of common. However, it can be skewed in the medical students as well. Having said that, there might be 2-3 issues where a student enters a professional course. One is the expectation versus reality of the course, and how student is equipped to cope up with the difficulties in the enduring difficulties in the course, especially medical students where he is an eternal learner. So you have your UG classes, your PG, and then you super specialize. So one aspect of the mental health issues, may not be a disorder on most of the occasions, but it can cause dysfunction to these people. One is the stress of adjusting to the new curricula, as well as the hostel life, the campus culture, which is way different than the very secured, homely atmosphere. At the same time, we should not forget these students are also entering into, they just crossed their teenage and they're going to be adults. The issues of the transitions, like body image issues, relationship failures, relationship build-up, expectation from relationships, parental expectations versus mismatch, all these can lead to a chronic stress formation. It's not that everybody decompensates here. Some people are equipped, some people get support. However, yes, things were different, say about 20 years back or 10 years back, where the channel of communication between the seniors and juniors were much more vertical, and it will be more of extracurricular communication. So a lot of stress could be buffered by the seniors. But of late, we are also worried about the ragging incidences. So, the first years are very secluded. So they don't get the chance to get the Guru Shiksha from the immediate seniors, and who are the first-hand experienced people of how to enter into the campus. So that can lead to a lot of stress-related conditions. Of course, depression we see quite commonly in these students, where there might be an underlying mental health issues, there might be family issues going on, and it can be a culture shock when they enter the campus. So depression is something which we quite commonly encounter. Early substance use, which is a very, very cultural connotation in these campuses. Like, you take a shot of cannabis or cigarettes or alcohol, which can help you man up and face the curricula ahead. So substance use initiation is something which we are really worried about in students. Hardcore psychiatric disorders often gets diagnosed very late in the trajectory, because there's a misconception that these students who enter into medical stream or any other higher professional, they are equipped, they are all sorted out in their head, and they can manage anything which comes in their way. Strangely, academic failures, absenteeism, not going out of the room, not gelling with the students or their peer groups, which remain in the confines of the hostel. So when it comes to note, it is actually too late. So we do find hardcore psychiatric disorders, I would say, like psychosis or the florid mood disorder, quite late in the presentation. To sum up, more of the neurotic spectrum is very common in the medical students, if not disorder, but of course it causes dysfunction, and definitely symptoms wise, it is quite commonly seen. I hope I answered the question.
Yeah, very much. Thank you so much. Thank you.
My question is to Dr. Vikas Menon. How frequently do medical students seek mental health services?
Thank you for the question, sir, and good evening to all my co-panelists as well as all the other participants in this panel discussion. I think this is a very important question, because medical students as a group are known to deviate from the norm of seeking help when they fall ill. They tend to self-diagnose and treat a lot, and even if they do seek care, they do not opt for formal health services, but seek mostly informal advice from their colleagues peers or prefer corridor consultations with their seniors. The evidence says, in fact, in one of the largest systematic reviews to date, which was published in JAMA in the year 2016, the authors actually pooled data from more than 160 studies, and they had more than 1 lakh participants' data there. The findings were very interesting. They found that the pooled prevalence rate for depression among medical students was about 27%, meaning that more than a quarter of these students experienced significant depression. But only 15% of those who actually screened positive for depression had actually sought help. Now, we need to keep in mind that this is not 15% of the total student population, but only 15% of those who had problems, mental health problems that were severe enough to warrant professional help. So that means that less than 1/5 of medical students who actually need professional help are actually getting it, or actually are, more correctly would say, are actually seeking it. And I think these figures are really should be a cause of concern.
Thank you, Dr. Vikas, for
Dr. Manish Patla, since you have been working for a long time in an institution, in a medical institution, what kind of mental health services are available for medical students?
Good evening, sir.
Good evening, boss.
I don't think that there much of the difference between the private, because the problems remain the same everywhere, whether it being a private institution setup or a government setup. The only difference is the environment that is being provided. Because in a private medical colleges, as I can vouch for, is there's a mentoring system that has been established. So a particular group of students are being allotted to a faculty in the first year itself. And that same set of students remains with that particular faculty for almost all throughout their teaching tenure. And there's a specific time that has been fixed, which is almost, say, we can say once in a month, they can approach, they are allowed to meet the faculty, and the problems can be discussed and as far as possible can be resolved at the personal level. And in that case, if something which is beyond the level can be resolved within the students and the faculty, principal or the administration can be approached for this reason. Only thing, apart from this, in addition, one-to-one counseling is also that is being carried out, especially in this post-COVID, wherein many students that have been approaching with anxiety disorders, as Dr. Shri has already mentioned, the students, they are coming up with common disorders, and majority of them, or I can say many of them, they do not qualify for a disorder to say, but have at least some of the symptoms that is affecting their functioning actually. So that is one thing that we need to take care of. And the first years that they were admitted in 2020, they are not exposed to the initial years of exposure that should have been in a college life. It was a dramatic, drastic change for them from a school entrance and then suddenly to a professional college without being to a college. So there are some things which are very new for them. So making them adjust to that at a personal level is something that private institutions do provide for. I've been part of this mentoring system for almost a decade now. And I don't say it's a foolproof system, but at least works out well for majority of the problems and can be resolved without issues. Thank you.
Thank you, Dr. Manish. Thank you very much for sharing your thoughts.
My question is to Dr. Naresh Nebhinani. Dr. Manish Batla enumerated the mental health services in private institutions. My questions to you is, in a government-funded central medical institution, what kind of mental health services are available for the medical students?
Good evening. Thank you, sir, and thank you, dear delegates. Just to add in the answer, because this one very clear finding is this: the services are not homogeneous all the places. But yes, by and large, at the good institutions, it should exist. And my experience I'll share. Here we have a mentoring system, as Sir has also added, and this is both faculty mentoring and peer mentoring, which takes care most of the needs. But yes, when it comes to mental health needs, then yes, at the screening level, we do assess to all the students of all these streams about their pre-existing psychological problem, which takes care of many problems. And two, once they have the problems, then yes, peer mentor as well as faculty mentors also facilitate their interaction to mental health experts. It consists of psychiatrists as well as clinical psychologists, typically as the hospital exists. But yes, in addition to that, we also facilitate the services of a student counselor, which is available in the college and more connected to the student. And yes, the students are also more comfortable to talk to student counselor. And whenever the student counselor is finding any problem which she is not able to deal in terms of in the counseling, then yes, those are also referred to the psychiatrist or clinical psychologist and Department of Psychiatry. So in a way, students have many facilities through the mentors, through the psychiatrist, through the clinical psychologist, as well as through student counselor. All of them are interacting regularly. So in that way, the students are pretty comfortable to reach to anyone. And additionally, their teachers are also in touch with all the experts. So yes, the timely consultation for their mental health problem is pretty much facilitated in most of institutions like us. But again, I agree, these services are not homogeneous and yes, not optimal most of the part. So which will come up with this interaction. Thank you, sir.
Thank you, Dr. Naresh.
Thank you, Dr. Sandeep and Dr. Naresh. And I request other speakers to mute themselves where our other learned speakers are speaking. The question is to Dr. Siddhar Sarkar from AIMS, New Delhi, since he has been working on substance abuse for quite a long time. And how commonly do you see substance use disorder in medical students, and what can be done to prevent the development of dependence in these people?
Thank you, sir. This is a pertinent issue in the medical school settings where people just start to initiate with substance use. They begin to experiment. And it has been seen that a considerable proportion of students actually would have taken some substance or the other. So if we see overall kind of prevalences, somewhere around 45% would have taken at least one of the substances. 1 in 3 would have taken alcohol, and 1 out of 4 would have taken tobacco and cannabis in 3 to 7%. But these are people who have just taken. They are probably not substance use disorder, but there's a potential of those who experiment. Some of them might actually become regular users, and frequently a minority of them would become actually either dependent users or users who have some kind of harm. So when we look at those who have problematic pattern, maybe around less than 5% would have some kind of substance disorder or hazardous use, maybe alcohol, maybe tobacco, maybe cannabis or something else. Now, when cannabis has increased in frequency and usage, and it is causing a lot of problems in many of the students, and it seems that over time, that is last couple of decades, there has been some increase. Now, what should we be doing to prevent occurrence of dependence? Firstly, from a local perspective, we should have a clear set of guidelines or some kind of policy from the institution per se, that is the medical school itself, which provides a kind of framework that if someone has been found to using substances in particular settings, so so and so action would be taken for that. So that clear kind of policy has a little bit of deterrent effect and may prevent excessive recreational use of substances. And secondly, medical students do have knowledge of what kind of harms are there and what is dependence and other things, but clinical exposure is something that helps them to actually relate from something what they have learned in the to what they actually see in a person. So kind of psychiatric clinical exposure is something that is likely to help. Thank you, sir.
Thank you, Dr. Siddharth, for your comments. Thank you very much.
Last question of the first round is for Dr. Grover and question is, what are the barriers to seeking mental health care among medical students?
Thank you, Dr. Goel, for the question. I think when we look at the barriers, I can just share my experience and whatever literature which is available from India. Few important barriers include, number one is that stigma attached to going for mental health treatment. And the stigma is not just among the students, stigma is among other specialists also. So they also somehow increase the stigma if somebody is willing to or interested in seeking a mental health care. For example, the hostel warden may herself or himself may frown on the children. So number one issue is the stigma, and which we need to fight out. The second issue, which is again very, very important, is from the mental health perspective, is that students always have this fear that whether whatever they come and share with us, will that be confidential or not. So the confidentiality is the second major issue. Then the third most important thing, what again we need to understand, that many times students themselves are actually not aware. There are few institutes only where they have clearly mentioned that services are available and you can go and seek help. Otherwise, students are not aware where to go and take help. So that's the third major aspect. Then it comes to stigmatization, or you can say that self-stigmatization, that they feel that if they go and seek mental health care, their teachers or their colleagues, peers are going to consider them as weak persons. So these are the major issues with respect to not seeking help. Besides that, there could be other issues about that the fear of what kind of intervention they are going to receive, or somebody who's having a severe depression may fear that they may be given ECT, or there could be fear of experiencing unwanted side effects. So everything depends on their knowledge about psychiatry, and that influences their barriers, how they don't seek treatment, although they are going through the tough time during their MBBS course or during their post-graduate graduation course. Thank you.
Thank you, sir, for a comprehensive answer. To sum up, in this round, we discussed about common mental health and substance use problems in students, mental health services available in government and private setup, and barriers in seeking help. With end of the round first, we move to round second.
Thank you very much. Continuing from what Dr. Grover said, in fact, I had a call just at 4 o'clock. One of the parents, in fact, mother calling that, Dr. Saab, you had seen the patient 1 year back and she is back into stress, but father says कि prayer करो, बाकी चीजें करो, recitation करो और prayer room में चले जाओ, सब ठीक हो जाएगा. So unfortunately, I would say the father is a doctor, a super specialist, and this is the way we go about students' stress. And we understand that they can have headache and we get it treated, but if they have stress, we feel that though it's all about stigma and we cannot have treatment from a psychiatrist. So the question in the second round for Dr. Manish Patla, how can peers identify the mental health distress among their colleagues? A very pertinent and important question. How to pick up such people?
Sir, if we see the chat box, there is a question regarding the same by Shazia Benazir. That is a classroom setting, how to assess the stress in students. I would say that this should be divided into three levels. One is when the problem is existing, but it's the behavior that indicates and it is not disruptive. For example, something like there is a decline in the grades, the performance, absenteeism from classroom is increasing. The usual, there is a marked change in the pattern of interaction among the peer group. That is the first sign that should give an overview that there is something that lies in the background for this change in the behavior. Then it comes to a point at the level 2 where it says, or it should be like, there is a behavior that indicates strong emotional distress, and at the child at the same time denies, as Sandeep sir said, he denies to gain treatment for that. And in that case, that symptoms something like repeated requests to the concerned teacher for extension of guidelines, deadlines for that particular date, and questioning, there is no valid reason for those extensions. Then comes the level 3, wherein these students, they either indicate they're something like beyond going to a state wherein we can say suicidal ideation, suicidal behavior, abnormal behavior, disruptive behavior, both in the hostels and among the peer group and with the teachers at times. So a child who was at times reported to be a good, sober student, all of a sudden starts being absurd, out of the situation, not acceptable into the current classroom situations. So the friends in the hostel and in the classroom should be aware of these sudden change in the behavior in their friends. And majority of the private institutions, they have displayed their points at the certain entrance points that in such a situation, who to contact. We are establishing a helpline and we have provided a 24/7 helpline numbers to at the common entrance points near canteen areas where the students are usually found. So that should be known and every student should be approachable for those reasons. Thank you, sir.
Thank you very much. Dr. Sandeep, kindly proceed.
Dr. Manish told how to identify mental disorders, mental distress in peers. My question to Dr. Naresh is continuation of that. Does training of peers to identify mental disorders in their colleagues help in early detection?
Thank you, sir. Part of the question has been answered by Manish, sir. So again, definitely yes, but how? It improves there if we are providing training to peers as a entire class per se, then yes, it improves their awareness about the psychological problem. It also improves the timely liaison or assessment by the mental health expert. 3, yes, and improves the support, overall support, because if they know, then they can definitely provide better support while somebody is seeking psychological treatment. And yes, it can also prevent many further problems, be it suicidal behaviors or be it other complications, because people do develop if they are not seeking treatment timely or properly. And yes, as touched by Sandeep Grover, sir, because if they are more aware, then yes, we are also working on stigma. It will definitely destigmatize to psychiatric problem, psychiatrist, as well as the person who is seeking treatment. So this is the thing which is going to give much rewards, because it is the gap whenever we are treating the students. If the peers are not attached and not supportive, then yes, the outcome is also not well. But yes, if they are available, then yes, we see many rosy pictures day in and day out. So yes, it does help immensely. Thank you, sir.
Thank you, Dr. Naresh.
Thank you, Dr. Naresh and Dr. Sandeep. Continuing with your question, as you have already elaborated upon about the suicidality among medical students, it only comes to 4 once we lose a loved one, a loved medical student of ours. But Dr. Vikas Menon, how common is suicidal behavior in medical students and what can be done to prevent the same?
Thank you for the question, sir. I think this question has two parts, basically. One is how common is suicidal behavior in medical students. So when we are discussing about this question, I think we need to understand that suicidal behavior in medical students comes on a spectrum, starting from non-specific suicidal ideation to a more specific form of suicidal ideation with a plan, and then a suicide attempt, and then probably for a minority, it may end in a suicide. So if we see the Indian literature, there is quite a lot of variation in the figures that have been shown. Studies from South India have shown that about 1/5 of medical students whom they surveyed, this is all single medical school surveys, about 1/5 of them reported suicidal ideation. About 1/10 reported a more specific form of suicidal ideation with a plan, and about 5% reported lifetime suicide attempt. A study from Northern India has reported figures of up to 50% for suicidal ideation. So it's in a range of about 10 to 50%. And if we go back to the meta-analysis that I was talking about earlier, the Rottenstein and colleagues meta-analysis, the pooled prevalence rate for suicidal ideation among medical students was about 11%. Now, coming to the second part of the, so it's fairly common. It's a fairly common kind of psychological distress and manifestation among medical students. And now, coming to the second part of the question, what can be done to prevent the same? I think a lot of attention has been focused on improving the knowledge aspect, both the theoretical as well as technical aspect of improving awareness about suicide in terms of the epidemiology, the risk factors, the early warning signs, and what are the psychological first aid that can be provided if we find some of our peers are struggling with suicidal thoughts. But I also think a lot of attention needs to be focused on a very complementary facet of suicide prevention, that is the attitudes towards suicide. So this is also something really interesting, and there is Indian research showing that medical students often harbor not so favorable attitudes towards suicide. In fact, many of the medical students express that working with suicidal clients is unrewarding. They're not comfortable talking to their peers who are experiencing suicidal thoughts. And also, minority also frankly expressed that indulging in suicide prevention efforts is a waste of time. So these are very strong negative attitudes that really offer opportunities for correctional intervention. But what kind of intervention can be done? That is something that needs to be debated. And I think a multimodal approach involving, there are studies showing some brief education intervention, mostly focusing on the knowledge aspect, using pre-post designs. They found that both knowledge as well as attitudes improved. But I also think there's a lot of scope for innovation here and using some interesting therapies like arts-based therapy or cinema-based therapy or role plays, because we really want to encourage personal reflection among the students and also improve their communication skills, which is a real big lacuna when they're talking to suicidal people. We need to know to use the right language and things like that. That's very important. So some form of art-based therapy, movies, cinema-based therapy, these role plays, these can also probably be incorporated, but these have not been formally tested so far. I hope I have answered the question.
Yeah, perfectly. I think you are right, absolutely right. That way, improving the knowledge among people about suicidal behavior and saying that he is a weak person, that's why his suicidal behavior is there. It's a common myth among masses, which is absolutely wrong, and the stress needs to be acknowledged, understood, and treated. That's the bottom line, I think. Thank you very much for the comprehensive answer. Dr. Sandeep, are you there?
So you can ask the question, sir.
Yeah. Dr. Shri, are there any gender differences in mental health issues among medical students?
Well, to start with this answer,
Shri, your voice is not clear. Shri, your voice is not clear. Maybe you can put off your video.
Dr. Mishra, your voice is not clear. May I please request you to put off your video and you can start the answering again?
It is not
Dr. Shri, sorry to interrupt. Your voice is not clear. Can you put off your video and restart?
I think she's not able to listen to us.
Oh,
can we go to the next question?
Is it okay now?
Yeah,
it's clear.
Yeah, you can start. You can switch off your video. Yeah, please go ahead. Go ahead. You can answer again. Please go ahead. Yeah.
So as I said that before answering this question, we should understand that both the genders enter into a medical school. The hidden curriculum is very different for both of them. There are gender norms, there are gender limitations in the academic curriculum as well as the campus milieu. So from the entry in the medical college, although anxiety, stress, depression is quite common in both of them, we see more of anxiety disorder in female students as well as mood disorder like depression. We have to understand why that happens. Probably there is a gender-related expectations in the medical colleges. There is probably, of course not now, but there is a limited avenue for them choosing super specialization or specialization. There is, of course, the personal milestone a female student would experience, like marriage, engagement, childbirth. Okay, so that can cause a lot of restriction in the way they might have pictured their medical schooling compared to their male counterparts. So that can create a lot of existential crisis, giving rise to anxiety and depression. Having said that, if the ragging culture has been very much diminished in the current era, there is no more physical ragging, I would say, in most of the institutes, but the cyber ragging is very much in place. Body shaming, cyberbullying, trolling, gaslighting, these are quite common phenomena which the young medical doctors experience. Okay, so and also the whole idea that females might not be great for the surgical branches, or they may not be good at snap judgments or making critical judgments. It's a learned way. It's a very culturally learned, ingrained way of projecting ourselves as a doctor. So these can give rise to the extra sort of mental health issues with the female gendered medical doctors go through. I hope I could answer your question.
Perfectly, Dr. Shri. I think absolutely spot on as far as gender difference are concerned and mental health issues in them. Dr. Sandeep Goel, are you there?
Yes, just join.
Please, sir, go ahead.
My question is to Dr. Siddharth. Does substance use enhance the performance in the exam in any way? Many students use substance to increase the performance.
Well, yeah. So the thing is that let's look at what kind of substances students use to supposedly enhance their performance. So I know once if people have to be awake at night, so they would take something as a stimulant to keep them awake. If you consider tea and coffee as substances, yes, that's quite acceptable to keep you awake. If you want to try something more than that, that has kind of cognitive effect, that even people are awake, but they are not able to focus that much. So it does not actually translate into improvement in performance, but a feel to a person that he has been able to put much more efforts, but actually it does not translate very well to any enhancement in performance. Another thing that people try to use is that they're very anxious before the exam. They are not able to sleep. So they would like to take something to help them to sleep by self-medicating with a benzodiazepine or something. But again, there is a problem that is some hangover effect. So the performance next day will be affected. So I will say, summing it up, not a very good idea trying things before exams. So.
Thank you, Dr. Siddharth.
Dr. Sandeep Grover, you work in a very big institution, and you always aims, you and your institution and other institutions which are centrally sponsored, financed, and which have a robust infrastructure. What kind of institutional policies need to be developed to improve the mental health of medical students?
Okay. Thank you, Dr. Majid, for your question. I would like to answer these questions in maybe two parts. Number one is what the mental health professional, the psychiatrist, needs to do, and how we can help the institute to develop policies. So in terms of we psychiatrists playing our role, I think some of the important aspect is that we need to be very proactive first. We always wait for the students to come to us rather than we going to the student and informing them about the mental health aspect. So that is the number one thing which we need to do. Number two is that we should not focus just on mental disorders per se. We should talk about more of positive mental health or mental health per se. So from that perspective, because till the time we will keep on talking about the disorders, I think we are missing the point, and that is where the students always feel stigmatized and they will not come to us. So that's the second aspect. The third aspect is that although the psychiatry is a specialty, but still, as I said, that in many places the students during their MBBS course don't come for psychiatry training, and they pass out their MBBS, pass out their MD, MS without getting any exposure to psychiatry. So they just hold some kind of an opinion about psychiatry, and that is more of a stigmatizing, and they think that nothing exists in terms of psychiatric disorder. So what we need to do is that we need to increase awareness about the mental health aspects among the other clinicians, so that they are open to sending the students to the psychiatrist, or they are open to seek psychiatric help. The fourth is at the institutional level, we need to talk more about the stress management techniques. And the other aspect in terms of psychiatrists is I would recommend, I'm sure my colleagues may agree or may not agree, but at this moment when we teach psychiatry, major emphasis is on severe mental disorders, and most of the psychiatric clinical training for the MBBS students is also more or less focused on severe mental illness. I think we should do psychiatry training in the CL psychiatry setup for the MBBS students, so that we can teach them more of common mental disorders, and we can show them how mental health aspects are important for the physical health and for everyone. So that is again going to help. The other aspect is peer support group. We need to have so-called mentors among the peers, that who can act as intermediary between the mental health professional or the teachers and their colleagues, so that if anybody is going through a crisis, they can identify and he or she can be reported, so that they can get a proper evaluation before it is too late. Okay, the other issue is having crisis helpline. Most of the institutes have now their student welfare cell or the crisis helpline. And with respect to that, again, I would say that in terms of psychiatric curriculum, we need to start exposing the students to psychiatry at much earlier stage in their career, rather than waiting for the second, third year. Maybe first year also, we need to have some exposure to the behavioral principle. That's going to help. And if a child is going through the crisis, I think we need to devote sufficient time for the parents, that we make them aware about the mental health issues, and we need to ensure them that nobody is going to stigmatize their children, or there's nothing wrong in having a mental disorder. And I would go to the extent at the end that if somebody comes out with their mental illness and seeks help, improves, and if he or she is prepared to open up in public, we need to glorify them, so that other people come to know. For example, we all know the cascading effect which Deepika Padukone had when she came out and talked about her depression, so that it destigmatizes the mental health disorders. So we need to work on that. I think that's going to help. And in terms of exams, I think the institutions now need to think about maybe either having a more exams in the form of objective or a combination of objective subjective. That's again going to take away some amount of pressure for the students. So that's again going to help. So that's what I would sum up, that we need to have a multi-pronged strategy to address these issues. Then only at the institutional level and at the curriculum level, that is only going to help us.
Thank you very much, sir. Very nicely answered. And if I sum up the second round, we started with how peers can identify their friends and colleagues suffering from stress-related issues. And the panelists experts said that it's a significant change in behavior or academic decline, or there is a gap in relationship, there is a break in relationship with the colleagues, or there are indications of suicidality in the person. Then how can we train peers to support their kith and kin or the near ones who are suffering from stress-related issues? First is that we need to make them aware that there is something called stress, which everybody can have. Then we need to develop a support system. And as far as suicidal behavior is concerned, we need to improve the knowledge about suicidal behaviors, in the sense that what are the early signs of suicidality. And it is really a myth that the suicidality is only among the weak people. Anybody who has stress-related issues can have suicidality, and it can be very well addressed and quite nicely treated and managed if a proper attention is given at a prior time. And we need to develop support system, and our attitude towards suicidal behavior needs to change. And then Dr. Shri answered nicely about the gender differences, anxiety and depression being more, particularly once you have a culture of cyberbullying or trolling or ragging more often online on social media, social platforms. Then about substance enhancing medications somebody is taking, or sleeping medications during exams, which actually is a shortcut and counterproductive in the long run. It will not help you at all. It might give you a temporary relief, but in the long run, you will end up in a mess, which will create problems for you and your family and colleagues. Then Dr. Sandeep Grover so nicely talked about institutional policies to be implemented, like mental health experts need to pull up their socks and reach out to people rather than discussing on only mental health disorders. We need to discuss about positive mental health and how to actually encourage people to come forward for their issues related to their mental health. And we need to teach them stress management techniques, and we need to open up crisis helplines for the people who are in need of addressing their mental health problems. Thank you very much. It was a lovely panel discussion so far, and if there are any questions which my friend Dr. Sandeep Goel can take up to take it further.
Thank you so much,
Thank
sir.
you, Dr. Majid. There are many questions in the chat box. Some of the questions I lost when disconnected. I am starting from the midway, and I have requested Raviji to send me the screenshot of previous questions. First question is from Dr. Shazia Benazir. Is there any specific tool available to assess the stress levels or suicidal tendencies in a general classroom?
Anybody can answer. It is not specifically to anybody, so any one of you can answer.
Okay, sir, I will take up that question. So the answer is yes, that there are specific tools that are available to assess stress levels among medical students. There is a very short questionnaire, is the perceived stress scale. It's a 10-item scale which can be downloaded and used for your if you want to use among your friends, you can freely use that. And for suicidal tendencies, it's a little bit of yes and no answer, because there are tools that are available for the Beck scale of suicidal ideation is available. It's a 20-item scale which you can use among your peers. But always, as far as suicide is concerned, the problem is tools really do not have much predictive validity in terms of actually predicting outcomes of who is, most people with suicidal ideation will not actually go on to attempt suicide. So our interest is in identifying that subset of people who have suicidal thoughts are going to progress further to an attempt. So from that perspective, scales are not going to offer you much. But what is perhaps more effective is just talking to that person and just trying to, do some brief interventions, like being with that person, talking to him about that stress, allowing that person to ventilate, or guiding that person to professional help if you feel that things cannot be solved at your level, you feel that things need a more specific intervention, you can always guide the person to a professional help service. So these are probably some things that can be kept in mind. I hope the question has been answered.
Yeah, thank you so
Vikas.
much. Dr. Kriti Pandey has asked a question, how to handle work pressure in clinical area. I think it is very pertinent, and particularly keeping in view COVID of 1.5 years. Anybody can take up the question. How to handle work pressure in clinical area.
Okay, if there are no takers, I take this. What we need to understand that first of all, we need to organize ourselves, and we need to understand what we mean by work pressure. I think a lot of work pressure comes in once we are not organized, once we do not seek our peer support, and we don't open up if we are going through a problem. If somebody is organized, himself or herself, is prepared to do the things in the right way, or if he or she is not able to do the things in a proper way, to seek help, and especially help from your peers. What commonly, if I can tell you why, in postgraduate institute where I am working, which is a very stressful institute, but if you have a very good relationship with your peers, a lot of your stress is actually addressed. Now what happens is that a person himself is not prepared to work and then tries to run away from the work, that creates a problem for the peers. That's why your peers don't become supportive. So I would say that the best way to handle stress is, especially the clinical care, is be organized. And if you're not able to take the amount of stress which you feel, or the work which you are allotted, talk to your peers first, seek support from them. If that's not working, go to the senior people and seek help. I think that is going to be the bottom line. But we all need to understand the stress threshold for everyone is different for all of us, and the medical curriculum, especially the clinical work, requires some level of dedication and hard work.
Thank you, sir. Next question is from Seema Kumari. And question is, what are the simple tips which medical students can promote mental health?
Sandeep, you can ask Shri to answer this question. Dr. Shri, would you like to take this question?
Yes, sir. I
Yeah.
hope I'm audible this time.
Yeah, very much.
Yeah.
Please go ahead.
So, I mean, it's a common saying that take care of your mental health. Actually, mental health and physical health go very much hand in hand. To start off, when they enter into a medical campus, what we need to be really careful about is something called as the stress mindset. So if you enter something with a mindset that it is going to be difficult, of course it is going to be difficult. Rather than changing your perspective at times that, you know, it is going to be fun, it is going to be challenging, and I might come out much more stronger and much more learned after entering the medical school. So that is one thing to do. Networking, of course, as Dr. Sandeep said, you know, networking from people with people who have endured such kind of stress and have worked on very high volume institutes. That is one thing, one tip which can help you and foresee how you have to structure your day, including some kind of physical activity. You remember, this is the time where a lot of us actually pile up weight. We are into unhealthy eating practices. So that is very important, where you take care of a little light, you know, morning walk or evening playtime. So that takes your mind off from the curriculum. Helping what can help you in a much more better way. Designing your own way of studying so that the study pressure is not piled up at the end of the, you know, semester. So planning is, of course, one thing which can be very important part in preventing a burnout or preventing a meltdown during your exam times. And, you know, stigma is something which has been spoken a lot about from many generations and ages. Stigma many a times lies within us. So, you know, if collectively you want to break the stigma and start seeking help with the available services, that is also a good way of, you know, preventing a major mental health breakdown. Okay, and in our campuses, you know, students have started a peer-led mental health services where the students don't need to go to the psychiatric consultants or, you know, psychologists, but a lot of buffer is around and available. That is one very beautiful way of breaking the stigma, normalizing stress, normalizing mental disorders. So these are the few tips which a person can use and go ahead with their medical journey.
Thank you, Dr. Shri.
Thank you, sir.
Yoshi Kastri has asked a question. When is the right time to seek therapy? What's the minimum threshold?
Yeah. Dr. Naresh, would you like to take this?
Yeah, sir. Thank you. Again, whenever you are finding any change, any difference, any difficulty, then please don't wait. Talk to someone. And since you are talking to someone as your friend, your peer, your mentor, your family, your teacher, or maybe your student counselor, so then yes, they will direct towards the right way. Because talking to someone is not receiving therapy, and someone is listening you will make you feel right, relaxed. And yes, somebody is assessing you objectively, maybe mental health expert at time of need. But then they will decide do you need therapy or not. But yes, talking to someone is as normal as we talk to anyone. So please talk, pour your heart out with some close person. And yes, as we are talking, that those peers and those mentors will facilitate the further journey. And then it will be the role of the mental health expert or counselor to decide to you need therapy or not. I hope I answered your question.
Dr. Majid, if you allow me to add a bit here, Dr. Naresh,
Sure, sir, please.
Yeah.
Yeah.
I would say that as early as possible, and whenever you feel like you need to vent out, you need to speak, please don't wait for somebody to say that you have a disorder. We as psychiatrists are not looking for students to come to us for disorders. We are looking for them, if at all they have small amount of distress also, they want to share, they are always welcome to the mental health professionals, and we all are there to help the students. So as far as the seeking consultation is concerned, as early as possible, whenever you feel that things are not right with you, as early as possible, or whenever your colleagues tell you, or your parents tell you, your teachers tell you, be open to the consultation.
Thank you, sir. Next question is from Julfikar Ali Ahmed. Sir, can you advise some techniques to overcome stress or depression?
Manish, would you like to take this?
Siddharth can come in. Siddharth.
Yeah,
Otherwise, I'll
let me
ask.
answer this question.
Sure.
And this is something very generic, that the way to handle stress will vary from person to person, what matches to that person's interests and proclivities. So each individual is unique. What worked from them for them might not work for someone else. At the same time, what works for his or her friend would probably not work for him or her. So having said that, there are many avenues or opportunities which people can use to handle their stress on day-to-day basis. This can include something like having an exercise which can improve the mood. It can be just going for a stroll. It can be watching a movie or a series for a short period of time. It can be talking to friends. Some people really like that and feel a lot of their stress level being reduced after that. Some people may like to pray for a while. So there can be many ways in which people can address their stress. One needs to know what works for them, and at the same time needs to bring it in balance. Doing excessive sports, even if sports helps a person de-stress, would create another pressure if time is being lost from studies. Similarly, if one enjoys watching kind of a comedy series, watching one episode is okay, but watching 10 episodes to finish the series, just to complete it because one is engaged, might create a problem additionally because time is lost from studying or other activities. So bringing things in balance is important. Knowing what works for them to distract them from stress, to relieve them from stress, is important. Apart from that, doing some things like managing their affairs in a manner that their time, their activities are accounted for or taken much more seriously would be helpful, because procrastinating things for the end while doing other things in the beginning, that tends to pile up things for the end and then increase stress as well. So having kind of schedule or budgeting time and energy would also be helpful for managing stress in the future. So these are some of the techniques that can be helpful for overcoming stress. One has to be mindful that everyone experiences stress. So there is probably no one who does not experience any stress, but people need to manage it somehow or the other. Thank you, sir.
Thank you very much. Thank you, Dr. Siddharth. If I may add, and I have made a mnemonic out of it, if everybody permits me to speak, and it is about A, B, C, D, E, F, G. A is adequate sleep. B is balanced diet. C is connect to your family and friends. D is devote to social causes and devote to Almighty if you are in stress. E is exercise, that too regularly. F is find help within your family, within your friend circle. G is you have to direct your goals in the sense that you complete your syllabus properly, complete your chapters in a given point of time rather than overstretching. Then you have H, you need to have revive old hobbies or create new hobbies. And I, most importantly, you need to innovate, introspect, and most importantly, involvement of mental health experts when you feel that it's out of your hands and you need help. So this is about it, adding to what Dr. Siddharth nicely elaborated upon.
Thank you, Dr. Majid.
I think this is an excellent mnemonic for everyone. I think everyone would take this
Thank you.
mnemonic and would be very helpful for everyone. Thank you.
Thank you very much. Sandeep,
More questions?
yeah, there are a couple of questions. If organizers allow us, we can ask them.
Sir, by looking into the time, we have already 15 minutes. Should it have the time
Okay.
and all? So if any particular
last question? Shall we last question will take? Okay.
Sure, sir, please.
Can you please elaborate upon how to manage stress during residency, specifically when their residents have their night duties very frequently without getting any night off? I'm asking this question It is from my PG student. Please, anybody, Sandeep Grover, please ask. You are from the place where the things are very tough. You can take up this question.
Okay, thank you, Dr. Majid. I think this is a valid question coming from the residents. And every institute has a different policy, whether you have the next day off or not, you are just doing night duties. So those are the issues which we need to keep in mind, but we need to develop institutional policies across the country of like maximum working duration per week. That is something which medical students have been asking for a long, and somehow that has not realized with the government. Many times people have gone on strike on this issue. So in terms of number one, reducing the workload, I think I would say that we need to so-called rationalize the working hours for our residents. That's
so what is
in
your
terms of
working hours? Yeah. Please go ahead.
rationalize
Please.
working hours. Number two, as faculty, when we are working with the resident who are working for long hours, night duties and everything, we should not inculcate too much of stress on them. As faculty, when I say this, means like any small mistake is always penalized vis-a-vis the resident has done 99 things to right. So we all need to be slightly human with our residents, encourage them that they are doing good work, good for a good cause. What happens that as a faculty, most often we end up telling our students or pointing out their mistake rather than telling them the good things what they have done, what they have missed, or we could have told them that what wrong has gone with them rather than shouting on them. So that's the second aspect of it. The third aspect of it is, I would again emphasize, students themselves also need to understand that we are here for training. So we have to give our best. Training is going to be hard, and training makes us tough to go through this. Once we go through this, we become much stronger in handling issues. So we have to be prepared. What we are seeing is a new breed of students who are not actually prepared to work hard. Somehow, students when they come, they have a very different kind of an expectation from big institutes, or let's say going through the PG course. Unfortunately, what is happening at many places that during the undergraduate, they are not exposed to the clinical work. Many students come to big institutes without being able to draw a blood sample. So they're coming from that kind of a background that they from third year they start preparing for PG. So all those factors contribute to the stress during the PG period, during the residency period. So we all need to work as students. I would encourage everyone to focus on the clinical work right from the third year, fourth year internship, so that once you come to the PG, you know what you're going to do. Once, because we do not go to too much of clinical work during our MBBS days, we don't understand what a PG student goes through. And suddenly once we come outside our so-called library, or we come outside our room and start working clinically, we think that what is happening with us? This is not what we expected. So that is where again a change is required. So these three facets needs to be addressed to reduce the stress in the residency.
Thank you, Dr. Sandeep Grover. Dr. Sandeep Goel, can you take over, please?
Dr. Goel, before sir, just a question, sir. As a layman, I have come across this question by Dr. Soumya Jaiswal. Maybe last question we can take. The question is about, she says that we all know that different schools of thought in psychology is progressing each day and are instrumental in dealing with mental health issues. However, the medicines and prescription drugs have a long way to go in terms of helping mental health issues nowadays. Now, part of the reason is that a lot of time the root cause of the mental issue does not lie in biological basis. Now, she's asking, so in the panelist opinion, what should be preferred? Do you prefer the therapy or medications?
Okay, can I answer this question briefly?
Yes, sir.
There is no generic treatment for people. Let's first understand. The treatment in terms of psychological treatment, in terms of medication or anything else, is determined on basis of multiple facets of an individual person in terms of their personality, the kind of disorder they are suffering from, the severity of the disorder. So most of the psychiatrists would prefer to treat common mental disorders where there is no suicidality, no threat to the life of the student, with psychological interventions. But if there's a threat to the life, aggressive management may include use of pharmacotherapy, and there is nothing wrong with it. Now, there is a question which I will just like to contradict here, that there is no biological basis. I think that's a very, very wrong understanding. Whoever has brought up this issue. Now, with the advancement of psychiatry, we have a good biological evidence for almost all psychiatric disorders, and maybe in next few years we will have much better understanding about that. So that's, again, I would say that this is another thing which increases the stigma about the mental disorder, that we don't know what we are treating. It's not that we know what we are treating, and there's a definite biological basis for various psychiatric disorders. Thank you.
Thank you, sir. Thank you so much. And before I ask Dr. Goyal to conclude the session, it is just something that I want to brought to the notice that with the help of Dr. Goyal and all the contributors of the book, we have brought out a new edition, the new book, which is called The Essentials of Psychiatry. So I want to ask Dr. Goyal that any particular things which you actually recommend to students, but what would be going to help the students through this book?
Regarding this book,
Yes, sir.
this is a multi-author book, and all the chapters are written by authors who are actually working in that area. And this book is compliant with recently introduced competency-based medical education, new curriculum, which is implemented by MCI, and most of the chapter have comparative nosology, where important differences between ICD-10 and DSM-5 are mentioned. Differential diagnosis is given special emphasis in clinical chapters to help the students understand the diagnosis of the disorder being discussed. Every chapter has key points at the end of the chapter, which summarizes the chapter and is useful in quick revision. These are the main key points of the book. It's a line feature.
Thank you, Dr. Goel. Thank you so much for the insight, sir. Now I request you to please conclude the session.
It was a wonderful panel discussion. All the panelists answered the questions comprehensively, and students were also very interactive. They asked a lot of questions, and I think it was fruitful panel discussion and it served the purpose. I'm thankful to all the panelists and students for joining this panel discussion, and also thankful to the organizers, Walter Kluwer, for organizing this panel discussion. Over to Dr. Majid.
Thank you, Dr. Sandeep. As I do always, that I conclude and with special thanks to Dr. Sandeep Goel and the organizers. I would start with experts, Dr. Sandeep Grover from PGI Chandigarh. Then we had Dr. Manish Batla. Then we had Dr. Naresh Nabinani, Dr. Siddhar Sarkar, and Dr. Shri, Dr. Vikas Menon as well. Wonderfully explained the stress among students, and particularly about medical students, and what are the different ways we can tackle them, and what are the different issues actually, and how we can make people aware, or their peers or parents aware, that their children are suffering from stress related issues. So I think it was a very, very fruitful discussion, I would say, rather than an interaction. And personally, I am honored to share screen. Otherwise, we would say that sharing dice with each other. Today, we had shared with screen with the renowned experts of national repute who are experts in their field. Thank you very much, and a special thanks to organizers for holding this special event. Thank you all.
Thank you so much, Dr. Majid. Thank you so much, Dr. Goel. Thank you to all our panelists and attendees. From Walter Kluwer, we continue to give you such fruitful sessions of different topics and subjects. Thank you so much from our end.
Thank you, sir. Thank you, team.
Thank you, sir.
Thank you very much. Thank you.